Hi everyone, this is Dr. Harriet Leyland. I realised that I hadn't done an introduction to the health effects of air pollution, so I thought that I should do that today really before I did any more in-depth presentations. So here goes. We know that air pollution can occur anywhere. What I'm really going to focus on today is ambient or outdoor air pollution rather than indoor air pollution, which is unfortunately a big problem too, but a different problem. And when we get poor ambient air quality, what that really just means is that the pollutant levels are such that they cause damage to human health or damage to the environment, or both. In 2012, the World Health Organization, the WHO, said that 1 in 8 deaths could be attributed to exposure to air pollution, and 88% of those deaths were in low or middle income countries. And air pollution causes a variety of health problems, so it causes respiratory infections, heart disease, stroke and lung cancer. And again, from the WHO's data, approximately 80% of the deaths were due to ischemic heart disease, things like heart attacks and strokes. 14% were due to chronic obstructive pulmonary disease, also sometimes known as emphysema, and respiratory infections, and 6% were lung cancer. It's interesting, isn't it, that the highest proportion of cardiovascular disease, not respiratory disease, but what that shows is that the inflammatory changes caused by air pollution have an impact on our cardiovascular system, and really how interlinked all the different aspects of our health are. If you're exposed to more than one risk factor, so rather than just air pollution alone, you might also be a smoker, and then those risk factors are additive, and so you've got an increased risk of getting cardiovascular disease or respiratory disease. In cities where there are high levels of air pollution, there's known to be an increased risk of heart disease and respiratory problems and lung cancer compared to cities which don't have such high levels of air pollution. And the people at greatest risk are those that are already ill, young children, the elderly and the poor, and those because they're all more susceptible to the effects of air pollution. And both long and short-term exposure can be a risk to your health. So asthmatics particularly have an increased risk if they're exposed to high levels of ground level ozone on a single day, so the increased risk of having a severe asthma attack, which can be deadly. And if you're chronically exposed to high levels of pollutants, then your risk of cardiovascular disease and lung cancer is significantly increased. So just have a quick look at particulate matter, or PM, and that's things like dust, dirt, soot, smoke and liquid droplets that are suspended in the air, and often produced by diesel vehicle emissions from coal-powered power plants, things like that. And they are divided up, these particles, this particulate matter, by their size. So PM10 are particles that are smaller or equal to 10 microns, and they have severe health impacts because once they're inhaled, they can accumulate within your lungs. And then the even smaller ones, the PM2.5, which are also known as the fine particles, and are approximately 1/30th the width of a human hair, they are even greater risk. Those are the most, have the worst effects on your health because they lodge deep down, right in the tiniest parts of your lungs. And where there's chronic exposure to particulate matter, you also see increase in cardiovascular disease, increase in respiratory disease, and increase in lung cancer. And there is a close relationship, a correlation between that exposure to those high levels of PM10 and PM2.5 and increased mortality, that's deaths, and morbidity, that's ill health, and that's both daily and over time. So in a high polluted area, if you look at the death rates on a particular day, or on a particular day where there's a higher pollution level, it will be higher than it would have been on a day with lower pollution. And again, if you compare one city with lower pollution and to one with higher pollution, you'll find that there's increased deaths and ill health in the one with higher pollution. There are also serious health risks from other components of air pollution, from ozone, as I alluded to earlier with asthma, nitrogen dioxide and sulfur dioxide. And again, all of these components of air pollution are more common in urban areas and particularly in low and middle income countries. As I mentioned, ozone increases asthma, morbidity, ill health and mortality deaths when the levels of that are high. Nitrogen and sulfur dioxide have a role in asthma also. They cause bronchial symptoms, so coughs, bronchitis. They cause lung inflammation and decreased lung function. What can governments do about it? Well, they should know what their main sources of ambient air pollution are. I mean, you know, your government knows whether there's a coal-powered power station in your city, and they should be implementing policies to improve air quality. So introducing better public transport, subsidising the cost of public transport, penalising businesses that are polluting the environment, introducing clean energy and providing subsidies for organisations that can produce clean energy, doing things for home energy efficiency. So if your home is well insulated, you're less likely to use energy to heat it, and that's a good thing, and in some governments will provide that insulation for free. Also, public awareness is really important. We all need to do our bit. Pollution doesn't respect country boundaries, so even if you're not living in a high pollution area, you can do your bit by reducing the amount you use your car, walking or cycling or using public transport instead. And even at the levels of pollution that we have in Europe or in North America, there is a risk to our health, so it's worth considering. So as I say, that was just a quick intro into the health effects of air pollution. As usual, if you've got any questions or comments, please feel free to make those, and I'll try and respond. And I will see you soon with a new topic. Bye-bye.